In Texas, more than 20% of coronavirus tests are coming back positive, but fewer people are actually getting tested. NBC News correspondent Morgan Chesky joins me now from the Neighborhood Medical Center in Dallas. Morgan, what do we know about this drop in testing?
Yeah, well, it appears to be a combination of factors here, Allison, and we've been at this clinic twice before reporting on the testing situation here in Texas. And I will say that of the 3 times we've been here, this is by far the least busy it's been. And part of the reason for that is the fact that some officials think that because we've seen that basically length of time for a while where it was taking days, even weeks for testing results to come back, it discouraged a lot of people from even getting tested in the first place. The only people that perhaps ended up coming here were those that were truly sick, instead of the recommended procedure of that if you have any symptoms at all or may have been potentially exposed, you were supposed to get tested. There's also the fact that there's been a report that there are hundreds of thousands of completed tests in Texas that have not yet been gone through and divvied up among counties. So there is a lot of questions being raised about Texas's testing situation, but firsthand reporting here, not as many people coming here, and the doctors here at this clinic tell me that it's been going that way for the past several weeks. Allison?
So, Morgan, you say there are fewer people at that rapid testing site where you are. What are you hearing from the folks who are showing up there?
Well, people are trying to be better safe than sorry. The numbers here in Texas are still present a long road ahead. We know that at any moment, unfortunately, Texas is about to break an unfortunate mile marker in the fight against COVID-19, and that is the death toll is about to eclipse 10,000 people. Keep in mind, we have more than 500,000 people here in Texas that have tested positive. And while we're seeing those daily cases and hospitalizations drop off in major urban areas like Dallas and Houston, the fight is still horrible in the Rio Grande Valley in South Texas. Allison?
Yeah, Morgan, let's talk about what's going on in the southern border. This pandemic is hitting that area particularly hard. What are you seeing in Texas's more rural counties?
It's a combination of things. You have, Texas, incredibly vast area. There are just a tiny handful of counties that have few cases there that are kind of located in the panhandle of Texas towards West Texas. But when you do have even small communities there, particularly in rural South Texas, that's where we've seen some of the biggest problems because you have those lower income families, you have scant medical resources, and then once the virus kind of gets hold, it makes it incredibly hard to contain within some of those areas for reasons that we've reported on before, with poor health being cited in that region, on top of the fact that you have children, parents, and grandparents all living in the same household. So in rural communities, we know that resources have been deployed to at least try and help out the situation there. Governor Greg Abbott extending that disaster declaration to make it easier to send state resources to hard-hit counties. But right now, it's still a long road ahead as doctors and medical staff there try to do what they can with what they have to handle the influx of COVID-19 patients. Allison?
Morgan, Hidalgo County sits right on the border. I know you've been in touch with health experts there. What have they been telling you?
Yeah, it's tough. They keep wanting to see kind of a light at the end of the tunnel, and they really have yet to do so. I've spoken with Dr. Ivan Melendez on numerous accounts before. He is the county health authority for Hidalgo County. He advises 5 different hospitals there. And what's interesting is that whenever we were seeing New York City locked down completely when the pandemic was wreaking havoc in that area, they really thought that they were out of the woods down in South Texas. But it wasn't until Texas opened back up in late May that really those numbers started to take off. And at least in that part of the state, while there have been moments where they've been not as bad, it's still brutal. And when I had a chance to speak with him most recently, he kind of described the state of affairs there. Take a listen.
The United States is a hotspot of the world for whatever reason. Texas is a hotspot of the United States. And the Rio Grande Valley is a hotspot of a hotspot of a hotspot. So, yeah, we're in a hotspot. There are 2 options how this ends. We run out of people that die, all the frail, all the elderly. Our populations are decimated the way we are now. The other end, which is what our nation banked on back in February, was to develop a vaccine.
The doctor told me a story about how he left the hospital one night and was planning on going home when he received a phone call from a funeral home director in his small community there who was, as he described it, having an emotional breakdown. He drove over to that business and there was one man surrounded by 90 bodies that had all succumbed to COVID-19. And he says that is the reality that they face in that area. And that's why they're doing as much as they can. They do have several federal medical teams that have been deployed to South Texas to at least try and help out. But the odds are definitely stacked against them, even at this hour. Allison?
It's quite a fight they are fighting there for sure. Morgan Chesky, thank you so much for your reporting. Have a good weekend.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.